Good day, everyone. Today we have Rudo Ramalisa-Budeli, and she's doing her PhD on a topic related to presence. And I've known her for a long time, and it's again a privilege to have you here, Rudo. Could you kindly introduce yourself?
Yes, thank you, Prof. You are correct. You've known me for a very long time.
Yes.
And yes, so probably from my undergrad up until now. So you've probably been involved in most of my development. And I think one thing that I've never mentioned to you, I truly emulate you for the person that you are. So
Sure.
thank you so much, Prof.
Thank you.
So basically, my name is Rudo, as you've mentioned, and I am doing my PhD currently. I am a mother to a 3-year-old. So she's the only one currently. And I'm a wife, and I'm a sister, and I work also. I'm a lecturer at one of the universities in Gauteng province. And and I've also done an advanced psychiatric course, which means that I'm an advanced psychiatric nurse, which is one of my passions. I'm very much passionate about psychiatric and mental health nursing. So yeah, that's basically about me.
Yes, thank you for introducing yourself. And I can really just say the same about you. You really have a presence about you that I admire.
Thank you. I also think that's something that grew over the years, because I don't think I've always had it in me, especially because with having to work in mental health has really helped me to understand myself and to be aware of myself. So I think with where the presence comes in, it's basically it really developed over the years. I would not say that I was I was aware of it, but or maybe it's something that I was born with. I don't know, but it's something that I became more aware as I was developing, as I was becoming the advanced psychiatric nurse, and the journey that I took. And one of the things that truly helped me was through mindfulness, because I got introduced to mindfulness at while I was working. But that's also part of and I think we're going to talk about it as the interview goes. But yeah, that's one of the things that I got to that introduced me to this presence. Yes.
I think what you're saying is so important in saying that it's a process and a development, and becoming aware and getting to know yourself and who you are and who you want to be with when you are with patients and when you are working as a nurse.
Prof?
Can you hear me?
Yes. Can you just repeat the last part, please?
Yes, I'm saying that what you are saying is so true, that developing as a person closely links to developing presence, becoming more aware of who you are and who you want to be.
Yes. Prof, one of the things that with the presence approach, I think, and I think many nurses, the one thing that they don't know is that they do enact, that they are present with the patient. It's just that maybe they don't know the concept of presence. But one of the things with presence, it's being aware of yourself, and being able to connect with a person on the level of human, or like you and I, as I can say, I'm Rudo and you're Emerencia, not I'm a professional nurse and you're my patient. So if we can connect on that level of you're a human, and I understand what you're going through, even though I've never experienced it, but I genuinely understand what you're going through, and I want to help you. I think that would be the foundation of the presence, the whole presence thing, if I can put it that way. Just being able to connect with human. But now you cannot connect, or personally, I cannot connect with a person if I'm not aware of myself, if I'm not aware of things that annoys me, or if I'm not aware of things that really ticks me, or if I'm not aware of things that let me give you an example in terms of mental health. If I'm not aware of what makes me angry, if, for example, a patient who's got personality disorder comes in, or a hyperactive patient comes in, and I feel that I'm becoming annoyed, but I cannot connect with that patient, then it literally means that I am moving myself, because I'm now putting in the professional part. And also that's one thing that the books have taught us as nurses to be. We need to act always, constantly. We need to help the patient. You just need to help the patient so that the pain can go away. But it's not always about just eradicating the pain and getting rid of the pain. The patient can still be in pain, but as long as you are there with the patient while they're going through that pain, just that being there with the patient and connecting with the patient on a human to human, talking about their experiences and your experiences, it can make a big difference. That's what I've learned throughout.
Definitely, I agree with you. It's really a journey, and really seeing the human being. And also, I agree with you so much that it's not a quick fix, but it's a journey with the person, trying to understand what they are experiencing and what it means to them.
Yes, I think also often because we feel that we have, as nurses, I'm speaking now from the point of being a nurse. As a nurse, we feel that we have so little time that we need to make sure that by the time this, and also because the policies and the bureaucracies of the ward, and also because there's money involved. So we often feel that, I've got so little time with this patient. How can I build a relationship with this person? So this presence, it's deeper than just having to say, I want to make sure this patient is fine. It's beyond the patient is fine, so yeah, it's beyond the competencies of the nurse. It's beyond they're just taking care of the patient. For me, and one thing that you really made me open my eyes, Prof, is when during this PhD journey, you mentioned that why don't I take it a step further and look into attentiveness, how attentiveness can play a role in how does attentiveness link with presence. And looking at attentiveness, attentive to, and being able to be aware, they'll be able to understand the patient's needs at a deeper level. So those are the kind of things that that really plays a role in for nurses. We care every day. We know we have to care. What are we caring for? What are we caring about?
No, definitely. And as you're speaking, I just realized that it takes that extra mile. It asks the extra mile of the nurse, actually going against bureaucracy a bit, or how can I put it? It's moving out of bureaucracy and moving out of just adhering to policy and really noticing the patient and attending to the patient's needs.
Yes, the individual, the patient.
Yes.
Exactly. Yes.
Yes.
Yes. I truly agree, Prof.
Mm.
Yes. I think that I've truly learned so much. I think even now looking back in hindsight, because the concept before you introduced it to me, it really did not, it didn't ring a bell to me. But as I've learned and I've become aware of the concept, I realized that there's so many times that I've seen nurses enacting presence, or even I myself, you know. And I can give an example. At one time, I think I was working at one of the hospitals. I was a comserve, working in one of the hospitals in Northwest. And I remember I was working with also another comserve, Sister Halani, who came back from a 3-day off. And basically what she said, we found a patient who hasn't had a bath in over the period that we were away. And the moment we took that patient and we took him, he was about our age. That's the sad part about it. But and he was paraplegic from the bottom down. So the moment we took him to the bathroom and we gave him a nice bath or a scrub, and just to get rid of all the smell and everything. And as it was going, because throughout the whole thing he was just quiet, but as we were about to finish, he started saying, "Thank you, sisters, thank you, sisters." But looking back in hindsight, even if then it was like we are doing our job, it actually, because that guy has lost his dignity. He's a young man, he could walk, and now because he can't walk, he hasn't been able to bath himself or even be bathed. And these two young people about his age giving him a bath, it might put him a little bit below where he was. But at that point, the moment he starts saying, "Thank you, sisters, thank you, sisters," you realize that you actually made a difference. So yeah, I think that's one of the things that looking back, I realized that, oh, you actually did enact presence, but even though you were not aware of it. So
Definitely.
sorry, I've got
no problem.
Somebody here came in.
Okay, no problem. Yes, and just that experience of that you made a difference, it means so much that you feel that you made a difference in someone's life, and that you can see the gratefulness and also uplifting his dignity as a person in acknowledging his needs.
Yes, I think this is dignity. It's something that it's not something that you can prescribe with a medication. And also with us nurses, something that we when you look at newspapers and you read about the way nurses are, you just hear horrible things, but often the nice things are at the back of the paper, where they will say, well, the nurses were singing to the patient. That singing, it's, for me, it's like they were singing for the patient, because they were trying to give the patient hope. You can't give hope in a tablet.
No.
So
no, I definitely agree with you that it's that little things that's actually the big things, and that it cannot be prescribed as a tablet or even as a nursing intervention. I think even if you have the prescription of give a bed bath or bath the patient, it's the how you do that that makes the difference.
But the one that's there for the patient, and the one that is attentive to the little things, and talking to the patient, asking the patient about what do you normally like to do. One thing I've also learned is sometimes you can also just be there for the patient for the sake of being there. You don't even need to say something, and also that's things that I've learned with being a psychiatric nurse. And when we do therapy with the patient, is that you can sit in a therapy room or in a session with a patient for 45 minutes, and the patient will be weeping and crying, and you just sit there and you hold the patient's hand, and and those are things that as a nurse, or you learn to be there for the sake of just being there, and to know that, oh, this is what happens when people cry. And normally when I cry, or normally when my child cries, I just want to give her a hug. But this is another person, so I can hold the hand. She is still a human. I'm also
Yes.
human. You can feel that thing coming here at your
Yes.
throat, and you also want to cry.
Yeah.
So it's okay. It's okay. And I also think now during these times, it's I do think about the patients, and thinking, when they are alone in ICUs and the families cannot come to see them, it might really be hard for nurses who develop that relationship with the patient, but now they can't, because of all the restrictions and everything. Now the patient doesn't have families, and so it really makes it difficult. So yeah.
I also think it's a very lonely journey for both the nurses and the patient in this time.
Yes, I concur. I agree.
Yes. Okay, I would like to hear more about the mindfulness, and then also continue with this idea of what the nurses and patients experience at the moment, and ask if you have a word of encouragement for them. But let me hear about the mindfulness that you spoke about earlier.
Okay. So mindfulness, to be honest with you, Prof, I had no idea that such a word existed until I moved from the Northwest, until I got another job in Gauteng province. And when I started working in a ward that offers mindfulness as a therapy, it doesn't offer mindfulness, it offers DBT as a therapeutic intervention for patients who suffer from personality disorders. So I realized, and mindfulness is part of that DBT. So really became fascinated in the mindfulness part. And one of the sisters who was working there, or I can say 2 or 3 that I've observed, were extraordinary sisters. And if I could mention their names, I would. But honestly, they were beyond the normal care that we can say, this is the nurse that we know. I've seen nurses before, but those nurses were exceptional. They were beyond competent. They were attentive. And I think mindfulness, where mindfulness fits in, is that it allows you to be able to be in the moment, to be present, to be in the here and the now, and but by using your breath and using your senses. So one of the things that if often we become so quickly aroused, or how can I put it, we become so quickly emotive, to the point where we make everything explode, but internally. So with the mindfulness, it allows you to take a breath, to breathe in and to breathe out, and to say, I'm alive. And I think, I'm not sure if those nurses that I've mentioned, whether they made it part of their lives or they've internalized it, but I've seen how they were working with patients, because they have literally internalized mindfulness and being attentive. Because when it comes to the needs of the patient, and putting the patient first, but also being aware of themselves and how they feel about certain patients, allow them to say, if they have a certain dislike towards a patient's condition or whatever, it does not affect how they treat that patient. If they have a dislike towards a condition of a patient, it does not affect how they interact with that patient. At the end of the day, when they interact with that patient, it's on a human to human base.
Mm.
And for me, as I mentioned earlier on, the journey that I've been through, I think if the universe is working in my favor, the universe is working in my favor. Everything that I have learned as far as has been coming together, in terms of learning about attentiveness and learning what mindfulness is, and being able to be able to practice it, not on a regular basis as I would love to, but being able to practice it and say, yes, I'm still breathing. I'm still breathing. So yes.
Wow.
I don't know if you would like me to say what mindfulness is and how
Yes,
it was invented.
yes,
Okay,
you
so
can.
basically mindfulness is it's a Buddhist, it's derived from the Buddhist religion, but the mindfulness part is practiced outside the religion, the religious part. So the meditation involves the person sitting down on a chair or on the floor and just breathing in and being aware of their senses. And whenever an emotion or whenever a thought comes up, then they just swiftly let it slide away and they continue focusing on the breath. So that's what the practice of mindfulness is about. And then, well, research and as I've learned throughout PhD journeys, that it has proven to allow people to be aware and to build relationships with people. So yeah, that's a little bit about mindfulness.
Wow. Thank you very much for sharing that. It's really a deep example of just breathing, being in the moment, helps you to not be reactive towards the patient and really just be aware of who you are as a human being and who the patient is as a human being. And that helps you to connect to the patient and be attentive to their needs.
Yes.
Wonderful. Thanks for sharing that. So, your encouraging words for nurses, I think by now you have already inspired many nurses in what you have been saying until now, but perhaps you have a specific message.
Sure. Well, I do speak to many of my former colleagues, and you know, just to hear how they are in the field, and just to say we're still praying for them, and you know, the work that they are doing, it's not going unrecognized, and they should not give up hope as much as they feel burned out and as much as difficult, but you know, they should not give up. There is a purpose for what they're doing, and without nurses anyway, in any hospital, in any healthcare field, I think it's just useless. It's a redundant thing. So we really need to know that this is a calling. It's something that, you know, it's in us. It's within us. So whatever they are doing, it's really big, and I truly hope that wherever they get their strength from, whether it's from their religion, whether it's from their family, and from just taking, you know, even though we can't go out now or have a social life, but you know, just to call people and to just get that encouragement from, you know, wherever you get that inspiration to say, okay, I'll be able to help the next patient that comes my way. So yeah, their work is not going unrecognized.
Thank you very much. That was very encouraging. Thank you.
Thank you, Prof.
Thanks. And thank you for sharing all the examples and the descriptions of presence that you have experienced yourself and read about. And I wish you well on your journey further.
Thank you so much, Prof. And yeah, thank you. Thank you for being part of the development that I've been going through. So thank you.
Thanks.